Coming up, we'll be on location at CCRM Northern Virginia in Tyson's Corner, Virginia, discussing the latest advances in fertility care and how they can effectively diagnose and treat infertility and help you conceive and build a family you've always desired with two of this region's top fertility doctors, Dr. Mark Payson and Dr. Vasiliki Moriani. Dr. Payson received his medical degree from Brown Medical School and is a former naval commander and director of the military's IVF program. Dr. Moriani received her medical degree from Drexel University College of Medicine and completed her fertility training at Harvard and Boston IVF. Both Dr. Payson and Dr. Moriani are widely recognized as two of this region's leading doctors. I wanted to begin, if I may, Dr. Payson, by having you please tell us about just how prevalent infertility issues are within the U.S., because it's a big problem, unfortunately.
Sure. In fact, infertility is much more common than is generally appreciated. So while about 85% of healthy young couples will achieve a pregnancy within a year of trying to conceive, about 15% won't. So, that is many, many couples that after a year of attempting to conceive, in fact, haven't achieved a pregnancy. And as they get older or have other issues, that percentage will get higher.
That's a substantial number, actually. I don't think a lot of people are aware that it's, as you said, younger couples are having a problem at a rate of about 15% as far as conceiving.
Correct.
And you said it gets higher as we get older.
Correct.
CCRM has been involved in groundbreaking research within the fertility medicine arena. And I wanted to ask you if you can tell us what that research has entailed and what kind of results have you all found from that research?
Sure. Well, CCRM, as one of the premier IVF centers in this country, has actually developed many of the techniques and methods that are used in IVF both nationally and internationally now. So at our main location in Denver, there is not only their IVF center, they have their own research center there where they pilot some of these studies. So most recently, a lot of the work in genetics has been very groundbreaking. CCRM is where the whole idea and methods of genetically screening embryos was first developed, and now that's been adopted very, very widely as a way of improving outcomes and being able to transfer just one embryo so we can avoid the risk of multiples.
Some significant work that you all have done.
Yes, our center is known really as one of the destination locations for IVF, and now that we've built up a network nationally, we are bringing that success to many other places in the country.
Now, what would you say, Dr. Moriani, are some of the most common fertility issues that you see in patients?
So there's a variety of factors that affect fertility. In a couple, a male-female couple, there can be issues on the female side with ovulation, issues with blockage or partial or complete blockage of the fallopian tubes, with issues with the uterus, anatomic or otherwise, general health conditions that can affect the ability to ovulate regularly and or menstruate and or get pregnant, of course. As well as other hormonal issues such as thyroid dysfunction, prolactin secreting tumors, and things like that. And of course, some medications can affect fertility or previous surgeries. And on the male side of things, there can be, again, overall health concerns, as well as specific issues with sperm parameters such as decreased numbers and motility of sperm.
Very interesting. Now, what would you say causes these issues to occur in the first place?
So that's a very complicated question, of course,
Sure.
And nobody exactly understands. There isn't one factor that can be identified as the culprit here. It's a combination of genetics, of environment, of time, and by that I mean age for both partners in the relationship, so both males and females are affected negatively in terms of their fertility as age goes on. And therefore, all of these factors combined or alone can lead to a decrease in the fertility potential for a couple.
Well, that's certainly good to know. At least we have some idea, right, of what
Absolutely.
causes these types
Right,
of issues. Are infertility issues hereditary, Dr. Moriani?
Some of them can be, absolutely. And these are, again, there's issues that can be controlled and issues that cannot be improved upon. So age we cannot change. Some of the environmental factors we could change. Stress is a big factor in fertility, and that could be improved upon often. In terms of genetics, that we cannot change, unfortunately. But hereditary factors would include predispositions towards things like PCOS, or polycystic ovarian syndrome, which can make it difficult for a woman to ovulate or release an egg on her own. Things like abnormalities in the uterus can be hereditary in the anatomy of the uterus, therefore leading to difficulty with implantation of the embryo, and overall premature ovarian insufficiency or failure, so a woman going through menopause at a much younger age than anticipated, that can also be hereditary. And also there's many other factors that need to be examined, such as genetic conditions that can run in families and therefore become an issue as a couple is trying to conceive, and some rearrangements of chromosomes that can be hereditary, and one wouldn't know they have those unless they tried to have a child and kept having repeated miscarriages.
Who would you say is a good candidate for fertility care and or treatment, for example?
Well, really any couple that is trying to get pregnant and unable to achieve a pregnancy, or even if it's a single person or a same-sex couple, can all come to us to be able to have a child. Now, there are ages and health conditions beyond which it is probably not a great idea to be reproducing or to be carrying a child. Certainly, after age 42, it is difficult to get pregnant with your own eggs. After age 45, it starts to be harder to physically carry a pregnancy. So for our women that are over age 45, there's some additional testing that we do to make sure that it's healthy for them to carry a child.
Certainly good to know. Now, I wanted to ask you, what is the evaluation process that a couple would go through when they first contact CCRM, whether it's here in Tysons for your Northern Virginia location or elsewhere around the country? Because we've had people ask us, how is it a time intensive? What's the process? Is it over multiple visits? Just so they have a better idea.
Sure. Well, the first step is always to come in and have a consultation and meet with the physician. And we'll review their history, find out what their goals are, and then we come up with a diagnostic plan. So the first visit is just sitting down with us, talking with us, learning a little bit about the process, and it's really for them to educate us about their situation and for us to educate them. And then we sort of set them off to do some diagnostic testing. Those involve a semen analysis for the male, several evaluations of the uterus and fallopian tubes, so an ultrasound and what's called an HSG for the woman, as well as some blood tests. And what those will do is give us a sense of where is the difficulty arising from. So is it an issue of ovarian function? Is it an issue of the uterus? Is it an issue of the tubes? Is it an issue of the sperm? And once we have all that, gather all that information, then the patient will come back, we will regroup, and we'll come up with a diagnostic plan, or a treatment plan once we have the diagnosis.
Yes, indeed. You'll have everything available in front of you.
Yes, hopefully.
To go over that with the couple.
Correct.
What options are currently available for couples dealing with infertility issues? What's, like IVF you've mentioned a few moments back?
Well, there are several options that patients that we have to be able to help patients, and it really depends what their diagnosis is. The simpler options are things like simply doing an insemination or giving a patient a medication that may cause her to ovulate if she's not ovulating. Now, if we can't achieve success with those earlier steps, then we move on to the more advanced techniques such as in vitro fertilization or IVF.
And can you please tell us about that?
Sure. So what IVF is really the gold standard of fertility treatments. As I may have mentioned, the normal fertility rate for a young couple is about 33%. So in any given month, there's about a 1 in 3 chance that a fertile couple will achieve a pregnancy. So our basic treatments can really never exceed that rate of success. So we'll generally try something like ovulation induction with a medication called Clomid, or inseminations for 3 cycles, and then reassess. If we're not successful at that time, then we often move on to in vitro fertilization.
Okay.
That's where we're gathering eggs from the woman, sperm from the man, putting them together and creating an embryo. Then that embryo can even be genetically tested to make sure that it's normal before we put it back.
And what would you say is the success rate on average for these options that you just told us about?
Of course, it absolutely completely depends on the couple's prognosis, the reason for their infertility, their ages, and the kind of treatment, and of course where the treatment is performed. At CCRM, we're very proud to have consistently above average pregnancy rates because of the advanced techniques and protocols that we're using. But in terms of success rates, on average, just being very, very generic, a couple attempting intercourse on their own will have every month about a 12 to 15% chance of getting pregnant and having a baby in 9 months. With the ovulation induction and IUI kind of protocols I mentioned, it's going to be in the 20 to 25% range, and with IVF anywhere between, again, for a roughly speaking 35-year-old woman and average prognosis, anywhere between 40% and 60 to 70% if chromosomal testing is performed on the embryos and they are normal embryos. And of course with donor egg, those chances are even higher.
Yeah, so your percentages are actually much higher than the 12 to 15% chance that couples would have on their own.
Exactly, right.
That's certainly good to know, Doctor.
Absolutely.
Very impressive. We're now going to meet a couple of patients of CCRM Northern Virginia. Welcome, Nicole. It's a pleasure having you on our program.
Thank you. It's nice to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, Nicole, if I may, by having you please tell us what fertility issues were you experiencing that brought you to CCRM Northern Virginia?
Initially, it was trouble getting pregnant, undiagnosed. Before CCRM, I had gone to another clinic where I only did IUIs, which are intrauterine inseminations, and with no positive results. When we moved to this area, my husband learned of this clinic, and we started looking into it, and we decided to come here.
Okay, so after having gone elsewhere previously, as you said, with no success, and having done some research, you and your husband decided to come here to CCRM Northern Virginia. And can you tell us what happened and what the process was like?
Sure. When we first came here, we met with Dr. Payson, and we discussed all the different options and the different results that could come out of proceeding with IVF. Once we looked at everything and we decided that CCRM Northern Virginia was right for us, I started going through a lot of tests, a lot of examinations and blood tests that were very, very thorough, much more thorough than my original clinic.
And then what happened after that?
Then we started the IVF process, which is basically preparing my body for egg retrieval. So I've gone through that stage. We were able to retrieve 7 eggs, one of which is viable, and hopefully later this month we'll be transferring the embryo.
Yes, indeed. That would be wonderful. We're happy to hear that. So 1 egg was viable, as you said.
Yes.
And what has your experience been like thus far with CCRM Northern Virginia?
Very positive. I have never once felt like a number here. Everyone's friendly, professional. It's CCRM. One of the reasons why we came to CCRM is because it's so science-driven. But CCRM also has here in Northern Virginia that human element to it, which is very important in this very stressful
because obviously, as you just touched on, Nicole, trying to conceive and have a little one join and make it a family, right? You and your husband must be a lot of stress you've been through, and now to finally be at a place where you're looking at a successful outcome with a little baby in the future for both of you, you've got to feel really good about that.
We do. One of the draws to CCRM was the fact that they do so much testing that not knowing right now what my ultimate outcome is going to be, I feel good knowing that we had everything, we had everything at our disposal. That everything was looked at, all the boxes were checked, and that in itself reduced a lot of the stress. I didn't have to feel like I was second guessing the doctor or the staff. I know that they know what they're doing, and that really brings me a lot of comfort and relief.
Especially when, as you just mentioned a moment back, that you would have exhausted every particular option that is on the market, right?
Right.
As far as that's safe, that can be effective,
Right.
and there's no remorse if for any unfortunate reason
Right.
that you don't conceive, because you know you looked at everything at a place that knows what they're doing.
Exactly.
And before I let you go, Nicole, is there anything else you'd like to share with our viewers?
I guess I'd just like to say that CCRM, the staff here and the doctors are top notch. I've never once felt like I was a number, that I was being pushed through the process. Everyone has just been so, almost like a family. I feel at home here, you know, and this is like the last place that a woman wants to come. But at the same time, it's been very comforting to be here and know that they have my best interests at heart.
Yes, indeed. And on that note, we'd like to thank you, Nicole, for sharing some of your experiences and being a guest on our program. It was our pleasure having you on.
It was great being here. Thank you.
Thank you. Welcome, Amanda. We thank you for joining us as well.
Thank you.
I wanted to ask you, Amanda, if you can tell us how you first heard about CCRM Northern Virginia, and what was the process like when you got here?
Sure. I first learned about it through CCRM Colorado, and then I learned there was a new location closer to me. I had a bad first experience with another fertility clinic, so I was looking for something different. And my first experience was very positive. I met with Dr. Payson, and he had clearly reviewed my medical history, kind of unique. I have a genetic disorder, and he had taken the time to read about it and kind of learn more about my condition, which I found impressive.
Oh, okay. So went through all that initially, and then what was the suggestion or the recommendation after that?
Okay, so I haven't started treatment yet, but I'm on the path to do IVF with PGD, which is genetic testing, so they can rule out like my possible genetic condition. And right now I'm waiting on my probe for that to be developed.
Oh, okay, very good, and hopefully you'll have a very positive outcome.
Thank you.
And before we let you go, is there anything else you'd like to add or share with our viewers?
Sure, I think for me I was a unique or a tough case, and I think if you are labeling yourself as that, this would be a good place to come to.
And lastly, what's your experience been like with the staff here?
It's been great. I feel like everyone knows who I am, and they take the time to ask me about my job and my life, so it's been positive. I would definitely highly recommend CCRM Northern Virginia.
Well, on that note, we'd like to thank you as well for joining us, sharing a little bit about your experience and being a guest as well.
Thank you for having me.
Our pleasure. Welcome, Brittany. Pleasure having you on with us today.
Pleasure to be here.
I wanted to ask you as well, if I may, if you could please tell us how you heard about CCRM Northern Virginia and what brought you here.
Yes, so it's a funny story. I was a patient of Dr. Moriani's at another facility, and when she left, we were really, really upset, and I might have, tracked her down via social media, and so I found her, and she gave me a call and said she was opening a new practice, and we waited, and that's how we heard about it.
Oh my goodness, so you've actually been a patient of hers for some time,
Yep,
and you
followed her.
felt so comfortable
Yes,
and
yep.
trusted her
Yep.
to the point where you even waited until
We did.
this clinic here was recently
Yeah, we
opened.
found out in April, and then she called us and said they weren't opening till July, so we waited till July.
And you're here, and how's everything been going?
It's going really, really well. I've had some hurdles, but that's why we love her so much, is that she's very compassionate and, puts us first. So, she has a particular game plan that she wants us to follow, and we follow it, and so we're hopefully getting started here in the next month or so.
And what's the option that's been recommended for you?
So because I've had to have several surgeries and like I said, hurdles that I had to go through, you know, a lot of testing, a lot of sonograms. So now the next step is medication and again, more sonograms. And
What has your experience been like with the staff here?
the staff is just as wonderful. Always upbeat, always smiling, so they bring you to that level. So you know, it's always been good experiences for us, but that's why we love them so much. And so if it's not a positive outcome that we were hoping for, the experience will be just as well, just as positive.
Yes, because of how everybody really cares about their patients
Correct.
here,
They-
as you've said, and other patients that we've had on as well.
Yes, they call you, they check on you, they make sure things are going well, and we like that.
And before we let you go, is there anything else you'd like to say?
Just that I highly recommend Dr. Moriani and Dr. Peason, and it's a great facility, and you'll be very happy.
Well, on that note, we'd like to thank you as well, Brittany, for joining us and sharing some of your experiences and being a guest as well.
Thank you.
Thank
I
you.
appreciate it.
Our pleasure.
Yes.
We're now back with the doctor. I must say the patients are very happy with the process, the human touch, the personalized patient care that they experience here coming to CCRM Northern Virginia. And in fact, one of their cases, Brittany, your patient, she actually said she was a patient of yours at a prior clinic where you worked, and she said that she actually followed you over there to here because that's how comfortable she is, that's how much she trusts you to really help her.
And Brittany, of course, is one of my favorite patients, but I form a bond with all my patients. They're all going through a very difficult time, and I try to be there with them every step of the way. And it's always extremely encouraging when it's very special to us when a couple that hasn't even been successful yet, they keep coming back and they keep seeking treatment with you just because they trust you so much, not necessarily because you were successful the first time around, because unfortunately it doesn't always happen that way.
That's right, that's right. And you got to keep trying, right?
That's right.
That's it. And because you offer the latest and the greatest here, not to mention the industry standards in some cases. So now we're literally out of time, Dr. Moriani, but I wanted to ask you before I let you go, you and your organization, CCRM, Northern Virginia here in Tysons, not to mention CCRM nationwide, certainly have state-of-the-art facilities. You're pioneers in the fertility field, not to mention you have established a reputation nationally and internationally, for that matter, for excellence. And you offer really great personalized patient care, as we just heard from some of the patients a few minutes ago. I just wanted to ask you what you feel helps separate you and your practice and organization apart from many of the other fertility organizations and clinics.
What makes me so proud to be part of the CCRM family, and what in my mind sets us apart, is this special combination of art and science, which is what medicine is, art and science. So in science, as you mentioned, we are in the cutting edge. We come up with protocols and techniques and technological advances that the whole field of reproductive medicine ends up using, and the success rates are much higher, and we're very confident in our ability scientifically. The art comes from our bedside manner and our hand-holding of patients and touching them in their lives as they are going through this very difficult process. And we are dedicated to being there with our patients as their advocate from beginning to end. So they get individualized care, attention to their specific case and their specific needs. And this is what I think helps make the difference here at CCRM.
Well, you're doing great work, you and Dr. Payson both. And on that note, we'd like to thank you as well for joining us along with Dr. Payson, educating us, and really, we really enjoyed having you both on, and it was our pleasure having you on, and we'd love to have you both back on in the future.
Thank you so much for coming.
Thank you so much for having us.
Our pleasure.